and thank you so much for tuning into today's video. I am joined again, this is our second chat that we've had together, by Dr. Keiron Lord, and we're actually going to be discussing about weight loss injections, and especially with the high influx that we've seen very lately with everyone kind of taking these now, not always correctly. We are going to be discussing a wide variety of topics on this subject, and it's something that we feel has definitely been requested and something that we feel doesn't have a lot of information for you to be able to make informed decisions about, you know, what you are putting into your bodies. So yeah, that's why we're here today. So I think Keiron's going to kick off with just about what weight loss injections are and actually how they're formed and what they're about.
Yeah, so thank you for having me back. And yeah, it's such an important topic. It seems to be in the news every other day at the moment. And so I think there's a lot of misinformation out there. So it's nice to be able to give people that information they need to go make an informed decision.
And a lot of overwhelming information because there's so many different sides of this, from health to weight loss to... Well, we're going to go into it today, aren't we?
And the fact that I think a lot of the time it's put across as quite a quick fix, but actually there's other bits to it. So essentially, without getting too boring with the science of it, the weight loss medications we're talking about are the ones people have heard of. So Ozempic and Wegovy. So Ozempic is kind of a semaglutide medication. Essentially, it mimics a molecule we all have in our bodies called GLP-1. GLP-1 is a hormone that's produced by your stomach, or by your intestines anyway, when you've had a meal. And it signals to your body that you've had a meal. You don't need to feel hungry anymore. You don't need to seek out food. And it slows down your gastric emptying so that actually the food sits in your stomach for longer and you can digest the food. The way that things like Wegovy and Ozempic work is they mimic that hormone. So it travels to your brain, you inject it, it travels to your brain, and it tells your brain you've had a meal. It can slow down your gastric emptying. It can make you feel full, and it also regulates your insulin levels, so it makes your body a little bit more sensitive to insulin, which is important, and we'll come on to later for not just weight loss, but for other things as well. Mounjaro's slightly different. It's a slightly different medication in the same class, so it's called tirzepatide. And it works by partly the same mechanism. So it interacts with the GLP-1 receptor. So it's the same as semaglutide in that respect, but it has an added benefit. So there's another molecule called GIP, which it mimics also. So that's why the results seem to be showing that it's slightly better as a weight loss medication, because it not only makes you feel full and delays gastric emptying, it also, in addition to the increasing the insulin sensitivity that the Ozempic does, it does that even more. And it also plays a role in fat metabolism, so breaking down fat preferentially over other things, which is what the aim of these drugs are. It also, in some studies, has shown that it can reduce some of the side effects, particularly nausea, which some people get with the medications. It's less so with the Mounjaro. So again, that might be a benefit. And in terms of kind of overall results, studies seem to show that Ozempic and Mounjaro, it's around 10 to 15% weight loss over time, whereas the Wegovy is more like 22, 23%.
But I suppose they're having more side effects with the Wegovy now. Would they get more side effects with that?
Potentially, because it interacts in different ways.
Exactly.
So it will get rid of some of the nausea, but it won't. So actually, with these medications, it's always worth thinking, find one that you think works for you and your clients.
And it's knowing the
them.
differences, isn't it, between them? Because I know with the Ozempic, that's obviously more diabetic prescribed drug, whereas with the Mounjaro, that one has the approval as a weight loss. So they're slightly different there, don't they? Because I don't know if Ozempic, has that been approved solely for weight loss on its own? Hasn't, has it?
No.
So it's just
off license if you're using it for...
Exactly. So it's only actually Mounjaro that has the license approved for weight loss in isolation without the diabetic.
So if something's off license, there's a lot of products we use in aesthetics. There's Botox products that actually are licensed for glabella and eyes, but not forehead and things. So you can use them if you've got a justification for it, but the person prescribing it has to justify that and say, actually, I've chosen Ozempic for this reason, and document that. It's not just a case of having it. So you've just got to be a little bit careful with it.
Definitely. And I think for me, I'm just seeing so many young people at the moment that are able to get hold of this without prescriptions in some cases. They're just kind of getting it from friends who are saying, oh, I've tried this, I lost loads of weight, and they're actually just injecting it with no further knowledge than the fact that they want to lose weight, which obviously is dangerous.
Yeah, and it is a drug at the end of the day. It's a medication. It was initially started for use for diabetes. So it is a medication. It does interact with other bodily systems, so it is affecting hormones. That's the way it works. So if it's used badly, it is dangerous. There's also different doses. So whenever you start somebody, you start on the lowest dose and slowly build up. And actually, you're kind of watching the side effects. And if the person is experiencing side effects, you may drop the dose down. So actually just saying, oh, here's a pen, I got this one, you might as well try it, just doesn't work.
And this is, I think, what some people have found the hard way, because if you were having that prescribed and you were getting that properly and that was prescribed to you, you would have all of those indications for you to say, okay, you're going to start on this dose, this is why, and things were a lot more explained to you. But I actually had a girl in here a few weeks ago and she'd managed to get hold of a pen without a prescription and she went straight onto a 5 mg. What do you think happened to her? She was so sick. She was so sick. And she had just had no idea. She says, well, why, well, surely I'd be fine on the 5 mg. But obviously the lowest dose is the 2.5 and you're supposed to gradually increase with a prescription. So,
and that's it. The side effects with it, you can... One thing is the nutritional element. So if you're not able to eat anything at all because you are so sick, you're going to get depleted of not just the food and the fats that you want to avoid, but all your micronutrients and things like that, all your elements. And it's really bad for you. So electrolyte imbalance can be a problem. Malnutrition can be a problem. Muscle wastage can be a problem. So there's lots of side effects with them. So I think there's an opinion that, it's just a quick fix, have this skinny pen. It's not called a skinny pen, but skinny pen. And it'll make everything better, and it doesn't. I'm not against them at all. I prescribe them. It's just they've got to be used in the right way, and they've got to be used in conjunction with other methods to lose weight.
And you can't just be kind of making those decisions on your own because you're able to get hold of one because you want to lose weight. Because I think when the side effects do come, you're very much on your own at that point because there's no one there that's prescribed that for you. So it's like you said, with the increased weight loss, because the weight loss is at such a rapid pace, obviously the fat pads are reducing a lot quicker than what they should be. So actually we see the Ozempic face where the temples are really dipped in, and Ozempic bum, pancake bums, because the fat pads have been increased at a level that is just far too fast.
Happens all over the body. So you'll see, you can spot people. You'll probably spot people when you're out and about shopping now, actually. It used to be just celebrity. People spot it out and about. If you go out into Nottingham here or whatever, and we have a look outside, you'll see people walking around and you can see the Ozempic face, the Ozempic bum. And I think even more noticeable now is the arms, top of the arms and top of the legs. Because the top of the arms becomes so thin, like the lower part of the arms, and the same with the legs. Because the way the medication works is it's limiting your calorie intake. So then your body's going to say, well, I need to make my own calories. And that the purpose of that is obvious, and that makes sense. But your body doesn't care whether you've got, realistically, that much muscle mass on your bum or in your arms or whatever. It just needs to maintain its energy levels to survive. So if people are taking the medication, so they're taking Ozempic or Mounjaro or whichever, and they're also maintaining a reasonably high protein intake, and they are exercising and they're doing squats or whatever, then the body goes, well, yeah, all right, you're getting protein and actually you are using these glute muscles, so let's not break them down, let's break down the fat. Whereas actually if you're not using your muscle, if you sat at home still eating your takeaways, injecting your medication and sat down watching TV, your body goes, well, actually you don't need these muscles, so I can start using them. And that's when people lose the muscle mass. And I always advise people when they're starting this, you've got to make sure you're exercising and maintaining some level of protein intake, otherwise you're not going to get the results you want.
And you're just going to kind of end up looking really sick. Like something's wrong with you. Because it's so obvious. Did you see the picture of Katie Price that came out recently?
I've seen a few of them. Usually
I know there's a few, but in particular the one where she's in a wheelchair. I'm not sure why. I think she's had surgery, and her legs are crazy thin.
It's like that she pops on Instagram and TikTok and things, doesn't she? And all of them are like that. She looks, it's not a healthy look. When you get to the point of losing muscle mass, that's not normal. Your body doesn't want to do that, and you don't want to do that. The whole point of these medications is you're breaking down fat, not muscle.
Yeah. So when it gets to that point, you just end up looking, and you can't see it. I think I've had girls that have come here in particular, and they're injecting Ozempic, they're losing the weight, and it's almost like, because they're losing weight and they feel better in clothes and they feel better from a social perspective, because they're going out, they're feeling skinnier, they're feeling sexier. It's almost like they're prepared to put up with the being sick and the side effects because they're so desperate to look and feel good. And I think, obviously, it's not just a case of, some people say, oh, just take Ozempic. It's not that simple. Some people might not be able to exercise as much because they might have something else wrong with them that makes it hard for them to exercise. But again, it's not the answer, is it? Just as a one-stop shop.
No,
people are getting addicted to these.
Oh yeah. I've seen it in my clinic. So not somebody I prescribe for, but somebody who I see for other treatments, and they have it. They're getting it online and from a prescriber. But getting it online, they fill in a form and they send some pictures. And I know the person has told me that she's adding padding and things to try and make herself look a bit bigger so she can still get the medication. So it is, people are getting addicted to it. And I think also it's because when you do your consultation for your weight loss drugs, which should happen, it should be a full consultation. It's about assessing the person's lifestyle as it is now. Like with a lot of things, say if your sleep's rubbish and your diet's rubbish, let's address that first. One, it's cheaper for the client, and two, there can be less side effects. So you sort out the lifestyle factors, and then you improve them as you start the medication. So you say, okay, here's your medication, but actually let's increase your step count, let's address your diet, let's give you some resistance training. There are ways to boost your body's own GLP-1, so moderate exercise is one of them. So do things like that and start the drug, and have a plan with your patient or your client to say, okay, how long are we aiming to be on this? What's your weight loss goal? How much are we aiming to lose per month? When do we stop? Because actually that's an important point which people don't discuss.
No one discusses that, and I think they go on it, and because they're so happy with the weight loss, they just, I mean, for you, with the research that you've done, how long would you recommend that clients should be on this?
Depends on the weight loss, really, and what you're trying to achieve. Realistically, 6 months is your minimum, is really a minimum. Less than that, I think you're doing it a lot. I think you're doing it too quick. If you try and do it, you can do it in 3 months, but just keep whacking up the dose. But I'd much rather monitor someone's weight. So I ask people to weigh themselves every day, and we take an average over the week.
Okay.
You probably know, like, one weight doesn't make a difference. If you have a load of carbs one day, your weight will be £3 heavier on the next morning. That's not because you put on fat, because you're accumulating water. So do your average weights. As you see it dropping, carry on that dose. You can increase it as they start to tail off, or you might find that you're developing side effects and you come back down the doses again. So I think 6 months is kind of your minimum. If somebody's got a lot of weight to lose, that might be different. But the whole point is, when they stop that medication, is to be able to give them that 6 month period of time where they've learned how to make changes. So to
so it's
learn
like
diet, learn
having
exercise.
those healthy habits throughout those months, because I think particularly the patients that aren't learning those healthy habits whilst they're on it for those 6 months, they're coming off it, they're experiencing major food noise because they're just like, wow, I'm so hungry. And because they haven't done anything healthy habit wise throughout those months, the first thing that they do is go, I need to take it again. I need another pen. They go, 2 weeks without it, and then they want another one. And
being cynical, I know, but I imagine from a drug manufacturer point of view or a prescriber point of view, if you wanted to be completely unethical about it, you continue making money the longer somebody's on these things. So actually you can see why there may not be an incentive to get your clients off them. But yeah, it's right. I think it's something around 60-something% of people who come off the weight loss drugs without any lifestyle change will put all the weight back on. So
is it that high?
Yeah, I think it's 62, but you'll have to check that. It's 60 something,
isn't it? Yeah, that's high.
Yeah, so it's significant, and that's why it's important to do the lifestyle bits as well. But also that, all these drugs have side effects, so the shorter period of time you can be on them, the better, really. Yeah.
And I think as well at the minute, especially for me, I'm seeing a lot when I'm going on social media, there's a new headline every day about weight loss drugs and how bad they are and how they can cause cancers. What's your approach on that, Keiron?
So they have been linked to a few things. The most significant one that seems to be out and about at the moment is pancreatitis.
Yeah, I think that's the biggest.
So there is a risk of that because it plays a part in your insulin metabolism, and your insulin's made in your pancreas. It can have an impact on your pancreas, and pancreatitis is dangerous. not to downplay it, in the hospital, it's something like, it's a significant percentage, 30-something% of people end up in intensive care with it, and a significant proportion of them can die as a result of pancreatitis. It's a really significant condition. So people need to be aware of that. There's a very slight increased risk of thyroid cancers as well. There's an increased risk of inflammatory arthritis and things like that. So there are some side effects with it. But again, I think that's partly people need to be informed of that so they can make a decision. And people need to be on it, the lowest dose for the shortest amount of time to minimise all those risks. I think the benefits of the medication for the right people still outweigh the risks, but it's just making that decision.
And that's where your prescriber comes into place, making sure that you're ethically getting hold of these and that they're actually prescribing the right thing for you based on the end goal, not just how skinny are we going to get by taking these pens.
Yeah.
Because that's what it seems to be at the minute.
Oh yeah. It's not in any way like checked or some of the things you see. Like, so I for example, I won't name the person, but they go to my gym in Warrington. If they're watching, you'll know who you are. I've been sat in the sauna some mornings at sort of 7 a.m. and I think this is this person's marketing strategy, which is to speak out loud, doing voice notes on the phone in the sauna, saying, "Oh yeah, don't worry, yeah, just send me your name and date of birth, and I'll get you a skinny pen off my prescriber." And I'm like, what? Like, yeah, that's not the way to do it. And I just think it's all part of a weight loss consultation where you can say to the person, "Look, this is the medication we can give you, but I'm actually not interested in giving it you if you're only going to be doing it and doing nothing else. Here's some lifestyle modification and some lifestyle and some diet advice. And then actually, these are the risks associated with it, but these are the benefits. Now what do you want to do?" It's like any consultation, risk versus benefit. Let them think about it, and then we can start the medication. I did 2 consultations, not Friday, gone Friday before, with 2 people. One of them's gone ahead, the other person's changed their mind. And I'm more than happy with that, because I'd much rather give somebody that information and then text and go, "You know what, I've thought about it. I'm going to try the diet and lifestyle stuff for now." Perfect.
And they've made an informed decision, and it's not going to create and cause them long-term side effects. And I suppose we don't also know all of the side effects at this point, because obviously with Mounjaro in particular, it's not been tested for long enough, right? No.
So some of the evidence is okay, is fairly good. So one of the studies done in America was actually really quite good. I think it was published earlier this year. And it basically showed, they looked at, it was military veterans in America. They followed 2 million people who were type 2 diabetic, who were on traditional medications. And they followed 1.7 million, and 200,000 people who were type 2 diabetic, who were on one of the newer weight loss medications. And so they did it for 3.5 years, and they found that there is that increased risk in pancreatitis, which is significant, 140% increase. So it's significantly increased. And there's a slight increase in the arthritis bit, but actually all the benefits that it found were really quite strong as well. So the risk of cancer reduces, risk of cardiovascular disease and strokes reduces. There's all bits like that. Alzheimer's disease is a big one. So there's lots of evidence out there, but it is all very early days at the minute.
And I think that's where we need to see more evidence and more case studies.
Yeah, done in a controlled way. So the reason that one was good was that you've got a big cohort and it's been done in a really measured way. People having an opinion on it. So I was fine doesn't count. It needs to be a proper bit of research done. I think they're great medications. They just need to be used in the right way.
And in regards to prescribing, are you a face-to-face prescriber?
Yeah. So the reason I do it many reasons, but the reason I do it face-to-face really is because I think it's important to see the person, carry out a thorough consultation with them, check the medical history, actually see them in person to see, body mass index and things. You can do measurements of body fat, and give them that proper, thorough consultation that they need to be able to make that decision. I know that there are a lot of places that do it online, which people sometimes find that's easier. They just click a button and whatever. But as of today, I think that's changed.
Yeah, something came out this morning, right, on BBC News.
Yeah, so they've now, the rules in the UK have now changed, that you have to be seen either in person or over a video call consultation with the person who's going to be giving you your medication, which I think is right.
Yeah.
We have to do that for other things. We have to do that for Botox.
Yeah, absolutely.
And actually, in a way, this is more important than that. Botox.
It raises the question there, doesn't it?
Yeah, because I mean, you know now if you ring your GPs, I've got a water infection. Okay, I'll send some antibiotics to Boots for you. If you don't need to be seen for that, I do still think it's a bit strange that you have to be seen for Botox. I think a video call for that would be appropriate, but they're not the rules at the moment.
It's crazy. It's almost like it's flipped.
But for weight loss, I think that's more important that you see somebody in person, because if you're going to say that for Botox, then for weight loss you need it, because you need to be able to see that person's body habitus and things like that.
Definitely. And I think as well, it's a case of being able to actually analyse someone's pre-consultation and what they might have had going on in the past and any medications that they're on. So it's like you said, your story with the gym. Or, just send your name, your date of birth. Actually, what medications are they on that's going to interfere with this? Or what medications have they been on prior? Yeah. It's not just black and white.
No. It interacts with a lot of things. So I think people need to have that consultation. Is there a risk? Are they trying to get pregnant? If they're trying to get pregnant, do you want them on a medication like that? A quick voice note in the gym isn't enough to find out that information that you need.
No, it's just not ethical at all, is it? And on the pregnancy, I am reading as well online in particular, a lot of people, they're calling them Ozempic babies right now, who are saying that they've actually had increased fertility whilst taking Ozempic that's been prescribed for them. What would be your thoughts on that?
Yeah, so my background's obstetrics gynecology, so I work in this industry in the NHS. So I think there's a couple of studies that are out that are, this is obviously very new. It seems to be two things. One is the weight loss. So by losing weight, your body's then able to regulate your HPO axis, your hormones axis better, which then allows you to ovulate more regularly and makes it more likely to get pregnant. The other bit that plays a part is that these medications are involved in insulin metabolism, or insulin regulation, should I say. People who have conditions like polycystic ovaries, where they are insulin resistant, so they have a higher level of insulin than other people, also struggle with fertility. So I suspect, and there's some evidence that maybe this is the reason why, but it's still, as far as I'm aware, out for discussion, that actually it's the insulin regulation that's making the difference. So actually being able to regulate a person's insulin. But that's in itself is a whole new topic of...
Yeah, it's like takes you into a whole nother realm, because again, it's not just there's so many different approaches to this.
So I like my longevity stuff and that side, and that's why the insulin bit's interesting, because insulin is, again, I'm taking it too boring and sciencey, but insulin is the hormone that regulates your blood sugars. So everyone's got it. So when you eat a meal with any sort of carbs in it, your insulin levels go up, and it's basically saying to your body, we've got energy here, let's use it. Now, if you think about it from an evolution point of view, it wasn't that long ago you'd eat and you didn't know when your next meal was coming. So you eat, you've got all this food, your body doesn't want to waste it, so it goes, okay, we'll use what we want now. If you've got a little bit of insulin, it goes, right, we've got a little bit left over, a little bit of sugar left over, let's put it into the cells and use it there. A little bit more left over, well, actually, let's not waste it. Let's tell the body to store it, and it does that in your muscles and your liver as glycogen. And if you've got even more than that and your insulin's really high, then your body goes, right, let's store it as fat, because we'll use it in the future, because that's what your body cares about. And if you think 10,000 years ago you didn't know when your next meal was, you'd very happily have a bit of fat.
Isn't it?
Now the world we live in means we're not, luckily most people aren't in that situation where you don't know where your next meal's coming from. And there's a lot of access to fast foods and things and processed foods. So our insulin levels are constantly spiking, because as soon as you eat something, insulin goes up. That's normal, but these constant up downs, we're not evolved to cope with that.
No.
So what happens is that it has an impact on your body. So things like certain conditions like Alzheimer's disease. Alzheimer's disease, there's a big group of people over in America, and it'll probably catch on here soon, they're referring to Alzheimer's as type 3 diabetes because it's so inherently linked with insulin resistance and high sugars. Cancers, certain cancers, there's studies done that show that there was increased risk of cancers in people who have high insulin resistance. And it all makes sense. And I think these drugs have got a place there to kind of help with that. So it's not just about weight loss. For the right people who have got high BMIs and can't lose the weight in other ways, then actually why not think about this? Because this will significantly improve their lives.
Yeah, definitely. And I think as well, I'd seen a study that happened in America also, where they were saying that I think it was the Ozempic was helping with chronic inflammation, so reducing inflammation of the gut, obviously, which therefore reduces inflammation of the brain.
Yeah.
So in some cases, depending on what your medical history is, it can actually reduce pains.
Yeah, inflammation, high insulin is responsible for releasing these pro-inflammatory cytokines, so pro-inflammatory signals in the body that don't just affect a certain area, it'll affect your brain, your organs, your muscles, your joints, everything. If you've got pro-inflammatory cytokines in the system, in the body, it's going to have an impact on the cells. So of every tissue in your body, your DNA is going to not divide properly, it's going to mutate. And this is where it plays into the cancer bit as well, because if you've got high insulin will, as I've said, will promote mutations in cells. So that's where cancers potentially start. You've also got something that's a growth factor related to insulin. So you get an insulin-like growth factor release when there's high levels of insulin. This is because what it's basically, the reason for it in your body is that your body's being told, if you've got high levels of insulin, you've got high levels of sugar, we've got loads of energy, let's get on and divide and repair our tissues. Right. Which is fine under certain circumstances when you've had a period of starvation for 7 days because you've not eaten because you're living in a cave somewhere. But now it doesn't work, because what it means is you've got unregulated cell divisions. It downregulates the process by which our bodies kill cells called apoptosis, which normally our body uses. If we've got a cancer cell, your body recognises it and goes, oh, let's turn that off, let's get rid of that cell. So we're now creating an environment where high insulin is not only causing mutations in DNA, which is responsible for cancer, but we're also switching off the safety mechanisms that our body has to protect against cancer.
Scary.
So some studies have said there's an increased risk of 30 to 40% of certain cancers with insulin resistance and high insulin levels.
That's...
So it's not just weight loss, it's so important.
That's very, very high. That's very high. That's like shocking.
Yeah.
And again, it's this lack of understanding, and I think people that are in vulnerable situations, because I think when someone is overweight and they feel like they can't lose the weight, they will almost do anything.
Yeah.
You know, I had another client who was taking, she was on the Mounjaro actually, and she'd taken that for about 8 months and her menstrual cycle completely stopped.
Yeah.
And she said it scared me. She said it scared me because I wasn't getting periods anymore. And I thought, I've took it too far, like I need to stop.
She lost a lot of weight.
A lot of weight. But for her periods to have completely stopped, that was what it took to scare her.
Yeah.
Not actually the fact of how much weight she'd lost, how quick she'd lost it. She came in and she was pulling her arms and the skin was just staying retracted.
Yeah. Just so dehydrated, isn't it? It's yeah, but it's all linked. That's how you start your periods when you're younger. It's dependent on body weight and body fat percentage. So if you lose that much weight or you lose a significant amount of body fat, your periods stop, and it's just a case of that should tell you your body's not okay anymore. You need to do something different.
What long-term effects could that have, Keiron? For that woman. So if their periods have been stopped as a temporary side effect, obviously once they've stopped those medications, the periods will regain. But could that affect them long-term in trying to get pregnant? Would you think? If
they restarted, then no. So actually, if you go back into a healthy weight, a healthy body fat percentage, you'll then carry on making your fat. Yeah. If you continue it, I can only imagine that you're going to have an impact on all sorts. Because actually, if you're not producing enough fat-soluble hormones, which are your sex hormones, that's your estrogen and progesterone, which we know through people who go through menopause, it has impacts such as reducing bone density and things like that.
Exactly.
I think if you couple that with the malnutrition, they're the sort of things you can expect.
And I think because these injections are stopping people from feeling hungry, they're also not drinking enough water, and it's just having this spiral effect. And before you know it, you've got clients that are going days without any food.
Yeah.
And they're just like, oh, I'm not hungry.
Yeah. Yeah.
It's scary.
Yeah. There was a guy, I don't know if you saw it in something online, I don't know if it was on a paper or something, but a guy who was some sort of PR bloke who basically was saying, and this is absolutely isn't recommended, but he was saying that he was microdosing with Ozempic or one of them.
Microdosing, this is what I wanted to speak to you about as well.
Yeah, so I think he was basically, he would take it, a very small dose for a week every so many months, because he basically says, well, I enjoy my food, but it allows me to lose a bit of weight in foot, and that's really dangerous.
So I'm glad you've brought this up, microdosing, because again, I do speak to a lot of people. Obviously, I'm in this industry, they tell me things, and I have a lot of people right now microdosing, making up their own dosages based on when they think that they're hungry, because they've gone, oh, you know, I was injecting it every week, but I probably know I shouldn't be because I have lost all the weight now, but I don't really want to come off it, so I just make up my own dose and just inject when I'm hungry or if I'm going somewhere. Yeah. And I'm like, oh my gosh.
Yeah, it's not safe. It's not going to work. And I just think, you know, as we said, it's about educating people in how to come off the medications. It saved them a fortune. You know, these medications, what, a month, about 200 quid, something like that. So why do you want to be on them? Like, let's get you off them. But I think it's just from that setting expectations early. You know, with Botox and fillers and things, if you set the expectations and go, look, they're coming for a certain treatment, you say, look, I can improve this, but it won't be the same as doing a surgical treatment. And at the end, you'll get this. They'll have a much better outcome. Whereas if they think they're going to get a really good outcome and they don't get it, they're not happy at the end of it. And I think that's the same with these drugs. Is saying, this isn't something you're going to be on forever. This is something we're going to give you now. And we want to talk about it and give you some advice on weight loss stuff, and we'll send you this diet plan, we'll send you this exercise plan. You stick at it with a view to we're going to come off it in the future. And I think if you set that out from the start, that's okay.
And then because it's getting into the client's head that this isn't just forever. And I think this is the problem when they're not having consultations. They're just living in that bubble of this is going to be forever. But this has a really interesting kind of approach for me in particular as a woman. How this might affect like reconstructive surgery going forward for people that have got maybe implants in the bum and they're getting a Ozempic bum and everything's flattening down. I've had a few girls in here saying, you know, what can we do with my bum? Because it's like hanging off and it's so tricky because it's like, wow.
Yeah. And actually you end up then trying to replenish volume loss, which you may have to do anyway. So I think if you lose weight, you're going to lose you know, volume in the fat pads of the face and things like that, and that's always going to happen if you lose weight naturally or whether you don't. You have people go, I've lost a lot of weight and I feel sometimes I look old, and it's like, I think it's still, the benefits are better because you've lost the weight and it's better for you in a lifestyle point of view, but actually you've then lost the cheek pads and things like that, so you have to revolumize. I think when it becomes, you know, you're losing your bum, you're not necessarily losing fat there, you're losing a lot of muscle as well. And actually, you know, the outcomes, if you do lose weight very, very quickly or lose a silly amount of weight, then it's all about the skin laxity and the sagging skin that people don't like. So then you just replace one problem with another.
Exactly. It's almost like shifting that problem, like you said, to something else. And a term I hear a lot is, oh, I look great in clothes, I look shocking without. Whereas before it was the opposite way. They'd feel uncomfortable without clothes on. But then when they're in clothes, you know, it's fine. But they feel more uncomfortable because of things like intimacy, things like that. But actually, I'm getting so many people now that are saying to me, I look awful without clothes. Because everything's just gone downwards.
You lose weight too quick. You lose fat and muscle. And once it's gone, it's hard to kind of bring back. You ever seen like lip fillers that have been overdone, not by one of us, but lip fillers and then you've dissolved them and you're going, I don't know how I'm going to put the filler back there because they've been so overstretched, and you've lost it very quickly. You've dissolved it and within 24 hours it's gone. If you'd kind of left them fillers over time, they might have naturally just gone and the lips would have naturally shrunk back down with them because you've lost it so quick. And it's the same with this. You've lost the weight so quick, which is why small doses regularly while you can still eat a small amount, and you focus that on protein and things like that you need to be eating to maintain your muscle mass and your exercise. So as you're losing fat, you might be losing fat off your bum, but you're building the glute muscles and things to kind of replace a bit of that.
Yeah.
You're still going to need little tweaks, particularly maybe cheeks and things like that are often ones, and temples, like you mentioned earlier.
Yeah. I think temples are one of the first giveaways for me that someone's on something.
Yeah, but just little bits and everything in moderation.
We tend to lose sight of that, don't we? We're like, everything's marketed. And I think the marketing of these drugs is quite naughty. You know, miracle weight loss drug. You see it everywhere. Yeah. It doesn't help.
Yeah. No. Everyone's on them.
So, hypothetical situation. I have walked into your clinic. I've said, hi, Keiron. You know, we're already friends. We're already chatting. We've already got a rapport. And I've asked you to prescribe me weight loss injections.
Yeah. So I always have a 45-minute appointment for first-time clients who come in wanting weight loss injections. The purpose of that is to get a thorough medical history off them to start with, make sure there's no reason why they can't have the medication, make sure there's no other contributing factors to why they can't lose weight. Find out about their baseline. Are they exercising currently? What is their exercise level? It's okay if not. It's okay if they can't, or they're very limited, but you need to find that out. Look at the diet and understand if they have a good understanding of what their what healthy foods should be. And we do all that bit first. Then we go through the lifestyle factors and exercise, and we talk about the weight loss medication after that. I think these weight loss medications, really important to point out to people, is that these are the last resort because they come with side effects. So if we can manage it in a different way, then that's brilliant. So usually we start with things like, what's your diet like? So what do you eat on a daily basis? Really, high protein intake, as we all kind of know now, high protein is kind of the way to go. Alongside that, fat and carbs are still important, probably more fats, to be honest, than carbs. Protein tends to make you feel fuller for longer, so you eat less. So we talk about diet, talk about sort of calories in, calories out. It doesn't necessarily always work, because this is where I might get into a bit of trouble for saying it, but calories in, calories out kind of works, but also doesn't. The idea is that you eat a certain number of calories and you expend a certain number of calories during the day when you're out and about walking around or exercising. But actually, there's certain foods that your gut microbiome will take a certain amount of energy from. So your whole foods, your non-processed foods, your gut microbiome will use some of that and therefore will burn some of those calories itself.
So it's not quite as straightforward. Yeah.
Okay. But yeah, you've got that and you've got your energy. And then you've got to think about your exercise. So what are you exercising at currently? Well, I've got a job in an office and I don't really go out when I get home. It's dark and I've got to look after the kids. And okay, well, what can we do to improve that? So when you go into work in the office, have you got stairs? Do you take the lift or the stairs? Try and do the stairs. Try and do half of the stairs and get a lift to the next floor. Park a little bit further away. It sounds daft.
On
park a bit further away.
It's just about creating some healthy
things
psychological
like that.
habits.
If people have got a watch or an iPhone where they can track the steps, try and increase the steps. And this 10,000 step rule is great, and I like it, but I think it's a great marketing thing. But if you're doing none, to say do 4,000, go up to 5,000, things like that, building that up. Most of your calories burn are done not in the gym, it's when you're out of the gym and you're doing your daily life and walking around and things. So yeah, increasing exercise, improving the diet, improving people's sleep. So if people are sleeping 4 hours a day and the cortisol levels are dead high because they're stressed, they're not going to be in an optimal state to lose weight. So again, optimizing that.
So sleep's actually super important.
Yeah, sleep's really important. Sort of the ideal time is 7 to 9 hours, which I think is quite tricky to do.
I would be so happy if I had 7 to 9 hours sleep a night.
Yeah, but around that, and that's achievable, and quality sleep as well, not just quantity. So quality sleep, so actually having that pre-bedtime where you're not watching screens, you're not scrolling through TikTok, whatever. So actually you're going to get into a deep sleep. Other thing I'm really a massive advocate of is intermittent fasting. I think intermittent fasting works brilliantly, not just because of the fact that you're going to skip food, because actually you don't have to. You can eat during that window, but you've got that period of starvation, and that again plays into that insulin. You're not having those insulin spikes. Yeah. So we tend to, in my consultation, we talk about diet and intermittent fasting. If you're not already doing intermittent fasting, start by knocking your breakfast back by half an hour or an hour each week.
Oh, really? As little as that?
And eventually you'll get to whatever your window is. So it should be 8 hours of eating, 16 hours without. I do 12 till 8. So if you're used to having breakfast at 8 a.m. when you wake up, tomorrow do it at 9 a.m. Next week do it at 10 a.m. And eventually you'll get 12
so it's just
till 8.
about increasing that gradually.
Yeah.
And I think there is so many more studies and evidence based on fasting, because it's obviously been something that we've done for so long. And maybe people do skip that as a step.
It's a very easy one to do, because it's literally push your breakfast back. When you are eating, think about your protein intake. Outside of that window, you can drink water, you can have black coffee, so it's a bit boring, but be quite strict with that. Drink a lot of water when you are fasting, because that'll fill your stomach and make you feel less hungry. And after a little while, you get used to it. So things like that, I think, first. And then we have a conversation about the weight loss drugs. And it might be, we say, do you want to start all that in one go and the weight loss drug? Or do you want to start that for a few months and then come back in 3 months and see where we're at? As I said the other week, I had 2 people. One of them chose to go straight for the weight loss drug. I think that was the right thing for her. The other one chose to try the lifestyle modifications and then review it in 3 months, which again I think was the right thing for her.
So you've obviously managed them consultations thoroughly for you to feel that you were happy with their decisions as well. So that's very nice. But I'm glad that you kind of mentioned sleep and diet and all of these other factors, because again, I think maybe people can get overwhelmed thinking, okay, I am in an office, I don't have time to go to the gym 5 times a week. But it doesn't have to be like that. It can just be small changes that help gradual weight loss that actually equate to the end result that they're looking for, without putting their body under all this stress and kind of risk when they don't need to.
There's a lot of misinformation out there. I think things like, if you don't know anything about, and I'm not the biggest expert at all, but if you don't know anything about diet and exercise and things like that, and then you look at foods and you go, well, avocados are good for you. Well, actually, they're quite fatty. So, but they look like a health food, but they're not. So it's kind of educating people on what to eat. And there's so many things out there in the supermarket now that are protein, whatever, like protein pancakes, protein bread. You think, if you're going to eat normal pancakes or protein pancakes, maybe the protein ones, but actually there's probably a better way of doing this. So I think there's a lot around educating people on food choices and how to do bits of exercise, how to add it to the lives without it being overwhelming. It's like
definitely, because it's so overwhelming. So my mom, she has been diagnosed with various health things at the moment, and she's having to follow a very strict diet. So she's having to follow gluten-free, and what's the other one? The name has surpassed me. It's vegan. Sorry. So she's doing gluten-free, she's doing vegan. She took me to this store, this organic, natural store. I was so overwhelmed. I was like, wow, this is crazy in here. Like, everything was vegan, natural. And for someone that's not been in one of those kind of stores before where everything's like that, you just don't realise how many options there are. It was an eye-opener.
And it's easy though, if you're busy like you are, like, you're running a business, you're away a lot of the time, you're not getting home till late. I'm not going to cook something. I'm just going to throw something.
It's easy for us to make excuses. I literally brought a cheese toastie this morning from Starbucks. I drank my coffee. Obviously, coffee suppresses appetite. So I've drank my coffee. Happy days. I have not eaten that cheese toastie. It's cold and it's soggy and it's minging. So it's funny, isn't it? Because we can just not prioritise the right things, and actually, it's just a bit of self-discipline. And
it's very easy to get into bad habits. So I think little things. People look on social media, look on Instagram, look on TikTok,
TikTok
and
is so bad.
You've got fitness influencers who their job is to be a fitness influencer. So they can be in the gym all day, they can meal prep, they can cook fresh, they can do all this. And, that's okay for them. But if you haven't got the luxury of doing that, you don't want to be put off and think, oh God, I can't do this, or I have to have a weight loss drug because I haven't got time.
Exactly.
It's little bits. It's literally... little bits of, in lockdown, I remember I was probably like the healthiest, the fittest I was, because rather than going to the gym because they were all short, I was doing exercise things on YouTube, just like a what's it called, like the
videos and
like a high intensity hip
the hip
thing.
Sessions,
doing them for like 30 minutes a day at home, which is definitely manageable, and they have different ones for different abilities and stuff. And actually you burn a lot of calories during that time.
You don't realise.
And that's 30 minutes. So you can find the time to do it. If it's going for a walk, and meal prepping on a Sunday is...
I agree. It's about creating those healthy habits, and I think sometimes we can make too many excuses to pick an option that's not going to benefit us, health wise in the long term.
Yeah.
So, and I think this is where the fitness structures are a little bit different, because a lot of people that are in fitness, they have the nutrition background, so they're a little bit more kind of knowledgeable as to what they're eating, what those proteins and foods do. Yeah. And if I know, I've spoken to a couple of fitness instructors and spoken to them about weight loss injections, and the first thing they go is, oh my god, no, because they have that understanding from a food point of view.
It's not knowing where to go. So there's various resources. I've got a couple of blogs on my website about diet, weight loss, and about about the different weight loss medications as well, which are a starting point. But it's very hard to go out and find actual resources that are reliable to know what you should be eating, what you should be exercising, and things like that.
Yeah, definitely. And a bit of a horror story actually, but I am going to say it because I think, again, people making sure that they're not getting these medications without making sure that they're being prescribed. I had a client a couple of months ago now, and she'd managed to get hold of some Ozempic again, and she was taking one of the highest doses that you can literally get with no prescription, no nothing, just name, date of birth situation. And she actually ended up in the hospital with a blood clot. It nearly killed her.
Yeah.
All this just to lose some weight.
Yeah.
And she's literally can't even eat. She's literally having to eat now through, obviously...
the drip sort of thing, yeah. I don't know what the risks are with blood clots. It's probably, is it just down to severe dehydration and stuff? But either way, I think it just shows that
it's that lack of knowledge.
We don't know enough about it. It's a safe enough medication. The reason it was indicated is if you have got a BMI above 30, or you've got higher than that, very, very morbidly obese people who actually, if you live as you are now, in the next 5 years, you will die of a weight-related condition. Then that medication, with all its risks of pancreatitis and stuff, is a benefit. If you, like we all do, over Christmas, overindulge a little bit, put on a little bit of weight, and then I'll get rid of this.
Weight over Christmas,
and you think, I'll just have this jab and I'll get rid of it in a month. Then actually, the risk benefit there is it's not the same, because actually your risks of that are very little. And actually, you going for a run or exercising will burn that, and there's very little risk to that.
Yeah.
So I think that's just something that people don't think of.
100%. And then it's like the psychological aspect. When someone's losing weight at the start before it's become extreme, that person in turn receives a lot of compliments. Oh, wow, you look great. You must be really working out hard.
Yeah.
And then I think that person then feels that sense of, wow, I'm getting a lot of positive reinforcement, I'm getting a lot of compliments, and that obviously boosts them, makes them feel good, and they kind of miss that, I think. And then when they start to regain the weight, and I've spoken to numerous people that have said this to me, they almost miss that attention of wow, you look so good, and they crave that back, so they just go straight back on them again.
Yeah, I'd not thought about that. That's a really good point. I've got a good friend of mine who he actually doesn't drink anymore. He's an ex-alcoholic. And he told me a story very similar to that.
Okay.
He works with people with addiction now, and he said one of the big things around addiction is when you first stop drinking, like he said, when he stopped drinking, you'd go to a room, people, oh, don't you look well? Oh, you're still not drinking. It's been 6 months. Aren't you doing really well? Oh, you're doing great. Yeah. 12 months in, oh, it's just this person. And he said, you don't get that validation, that reassurance. And maybe it's the same. It sounds like it is the same with your weight loss drugs. I never thought about it like that, but you're right. It's kind of, that attention isn't there anymore.
It's the attention of saying, and obviously I think as a society, when we see people that have lost weight, we instantly see that psychologically as a good thing, and we're the quickest to compliment. Oh, you lost weight, don't you look good? Like when you go to a wedding and it's been a while, you've not seen people, and they say, oh, you've lost weight, you feel kind of like nice, don't you? Like, oh, thanks. Yeah.
And with the opposite, when it's somebody's lost too much weight, or someone's done something different, you'd never say anything to them.
Yeah.
I don't know, do you think maybe we should, maybe that should be more normalised, to be able to say to your friends, pushed it a bit far, whether it's weight loss, whether it's certain treatments that I've done, big cheeks and whatever, you go,
yeah,
you
because
need to
again,
calm it down a bit.
You can't always see it when it's yourself. It's like we talk about being filler blind. I think there is an element of being blind to other things when it comes to yourself, because you just kind of get caught up in this world of yourself. I don't know, it's hard to explain, but you know what I mean.
So maybe we need to normalise that. Maybe that needs to be normalised, that people can say to the friends, are you still on that weight loss drug? Do you think you need to give it a rest?
Yeah, because you look awful, because your whole face is like starting to...
Yeah. Because I'd want to know. I'd want someone to tell me.
True friend always tells the truth.
Yeah.
I think.
Yeah.
Yeah, definitely.
Yeah.
100%. And I think this is funny. This actually brings me on to another story about true friends and kind of... it was actually Sophia Bailey that brought this to light. So when you kind of go out and you have a big group photo with everyone, and the person with the photo that took the photo does their own tweaks on the face app with their own face, but they don't do any of the friends. So she's like there looking 10 out of 10, and everyone else is like, what the?
Yeah.
These are not true friends.
Or usually girls who take the photograph and they'll pick the one where they look brilliant. The bloke looks like he's had some sort of injury or something like what. But
because the girl that was good, she's like, oh, I'm going to pick this one. Yeah. You're just like, babes, have you even looked at me? She's like, oh, yeah, you look nice. And you're like, no, I don't. It's funny, isn't it, how we can just like totally go within ourselves and just be like, yeah, I'm going to do that one because that suits me. Does your girlfriend do this to you, Keiron?
I just have to take a lot of photographs. And everyone, she goes, why do you always look the same in them all? It's like, I just have the same face. That's just the way I look. Okay. And then she has to go through them.
This is a guy thing, because I said this to previous boyfriends of mine. I'm like, yeah, but you just do the same thing in every picture. Whereas girls, we tend to move a little bit, smile, like turn our heads.
Yeah, I'm got a clue. I had to do a photo shoot for the business, like pictures of me stood there in my scrubs and whatever. And I'm like, all of a sudden, I don't know what to do with my hands. Like, where do I put my hands? Because,
you feel awkward in that moment.
How do I stand? Do they go in my pocket? No, that looks weird. Where do they? Yeah. It's odd. So blokes aren't good at having photographs taken.
Did that photo shoot make you feel anxious, Keiron?
Oh, yeah. Definitely not my thing at all.
I love sometimes like just analysing the difference between men and women, because we can be so the same but so different. Yeah,
I wish I was good at it. I'm just not.
Well, you never know. It might be something, the more that you get in your face out there, the more you just like a professional. Yeah. But
we'll see.
It's funny. So what would your top tips be for anyone that's considering weight loss injections?
I think if you're thinking about weight loss injections, just make sure you're firstly addressing your lifestyle factors first. So as we've discussed in this episode, optimise your sleep, optimise your diet, increase your physical activity. Secondly would be make sure you seek advice from a trained professional, whoever that might be, but somebody who is used to prescribing these medications and is used to also giving you advice on weight loss. And finally, if you are going to start the medications, do your research into which one you want to try. Speak to the professional who's advising you. And if you do start them, use them for the shortest period of time to get that weight loss kick-started, implement the lifestyle changes as well, and then know when you're going to stop the medication. And hopefully at that point, because you've implemented everything else, you can maintain that level of weight loss.
I think they're amazing tips. And I think a lot of those tips, if you actually break them down individually, they make so much sense, because it allows you to have a treatment plan that is manageable and that has an end.
Yeah.
And I think that's the biggest thing that we've probably picked up here, is that actually a lot of people go on to these as like a journey without an actual end date.
Yeah.
Which makes all the difference really between them being safe and not safe, and obviously everything that we've discussed. A little bit of a tip that I would like to add, just on a personal level, is definitely just for anyone that's listening that might be looking at TikTok influencers and kind of looking up to these people that are in the public eye. Just be really careful not to kind of look at influencers and think that because they're doing it, it's the right thing for you, and that you feel the pressure to then do the same thing, because influencers will only show you the best of the best and the best parts, and they will not be honest about side effects, because that's not part of their role as an influencer. And even though that sounds obvious, I think there are perhaps people that don't realise that, and I think that's massive. Yeah,
there's it's kind of like a sub, it's not called subconscious, but there's a word for it, isn't there, where subliminal advertising, where you see these things, think, oh God, they're on it because of this, but actually, these influencers may be taking it, but if they're influencers, they may be also in the gym a couple of hours a day, and they might have somebody who prepares the food potentially, or at least they have time to prepare the food. So I think there's a lot of stuff they don't know the full
picture. And I think when we see things, it can appear very black and white and easy, but actually you never ever see the full picture. And
No.
that's, again, brings back into what you said, Keiron. Make sure that you're speaking to an experienced medical professional that's going to be able to advise you on all of these things.
Do your research, find decent resources. There's lots of information out there. TikTok and Instagram probably isn't the one, except there are some really good people on Instagram who will be able to, who do put evidence-based stuff online. Have a look. I've said on my website, I've got a few blogs on there which will link you to some bits. But yeah, most importantly, just speak to a professional who will give you those risk benefits and allow you the time to think about it. Go home, think about it. If you want to start the medications, by all means, start them. If you've got a BMI that's high enough that warrants that, and you think that is something you want to do, and you've thought about the risk benefits and you're happy to do that, and you've got a practitioner who's experienced enough and can support you on that journey, then absolutely great medications in the right hands.
One question that I've actually forgot to ask you that I actually wanted to get your opinion on: where does these weight loss medications sit with things like hair loss? Because obviously hair loss is so huge at the moment and creates such a big insecurity for men and women. Is this something that affects hair loss?
So I think the fact that you lose, or you're not absorbing as many nutrients, you're not getting as much nutrients into your body, does show that there are signs then that you can have hair thinning or hair loss. So things like taking your hair supplements or biotin alongside this can be helpful. Even if you whether you start to notice signs of thinning, or even before you do that, you can start preventative things like PRP or polynucleotides. A colleague of mine, Dr. Kai, she does a lot of hair restoration stuff, and I'm terrified of going bald, and I will end up going to her at some point just for some preventative stuff here, because she tells me actually, if you can condition those hair follicles early on and make sure that they're healthy, they'll carry on. If you wait until you lose it, it's a bit hard to get it back.
Then it's a bit tricky. The reason that I actually asked you this is actually for a reason. So I've got a few ladies that I know personally that have had babies, they've been pregnant, they've had babies, they've had their children, but actually because they've just had their children, they have a little bit of natural hair thinning as part of that natural process of having a child. It can happen. I know that my hair thinned the most throughout my whole life when I had my little boy. And then they're going straight onto weight loss injections because they've felt big, because they've been pregnant. But actually, that's going to probably for them increase their risk of further hair loss, right?
Yeah. So it's another risk to think about. Hair loss is one of them. It's not, you're not suddenly going to go bald by taking them, but if you're worried about hair loss anyway and you're already thinning,
then it's probably
an extra thing to think about. And it might be that you say, look, I want to do that, but now I know that, I'll start on my supplements, I'll start on the biotin, I'll start with the polynucleotides for the hair loss, and I'll keep a very close eye on it. And
we're very lucky because there's so many other options right now. So even though I think weight loss injections have had a huge space in the media, they've had a huge space on socials, we do also need to remember that we are so lucky in that there are so many other options available to us. It's just about educating ourselves and understanding what those options are and keeping ourselves and our bodies safe.
The whole point of this is to make sure that you're healthier. The whole point is we're trying to lose weight to be healthier, and if you push it too far, you just become unhealthy in a different way. So just kind of keeping that goal in mind, that ideally it's all about being healthy, not just the numbers on the scale.
Perfect.
So thank you for joining me and Jessica today on this episode. Hopefully we've shed some light on weight loss medications, and giving you some things to think about. If you'd like any more information, as I've said, I have some information on my blogs on my website, which is drlord.co.uk. And if you have any questions about weight loss medications or want to get in touch for a consultation, contact me either through the website or on Instagram at drlord_. Thank you.